We are still dealing with a spike in COVID cases, and that also means a spike in hospitalizations. At the end of August, the 7-day average of hospitalized patients with COVID-19 in Wisconsin, 867.
About 90 of those people are on ventilators. Over 88% of hospital beds in the state are in use, and even more ICU beds have people in them. In Dane County, there are more people in the ICU with coronavirus than since the beginning of 2021.
And while hospitals say they're confident they'll have enough space, the growing concern is if they'll have enough staff to save lives. Adam Duxter was given an inside look into the COVID ward at UW Hospital and joins us live with the mindset of those frontline workers as they battle this latest surge. Adam?
Well, the healthcare workers we spoke with today have been dealing with the coronavirus pandemic for nearly 18 months now. And while they say they're confident about the direction things are headed, they're unsure about the impact it'll have on their industry as a whole.
Yeah, let me print my sheets off.
We wish that the community knew that we have their best interests in mind. We're not trying to hurt anybody's rights by any means.
The fight to keep people from dying from COVID-19 is at arguably its most intense point in 2021 for UW Health's frontline workers.
It, of course, is difficult to care for people who could have prevented their illness, but we can't go back and know what they were thinking at the time when they made that choice.
And it's taking a toll on many, including hospitalist Sam Murray Boehner. She says in the past, some staff would volunteer to work these shifts. The fear now is about finding people to work them at all.
There's plenty of times where there's physical hospital beds that are open for patients, but we don't have the staff to actually take care of people in them. So that's very frustrating when we feel like we're bursting at the seams, but you see these open beds, but there's no one to take care of people.
Murray Boehner says rather than feeling frustrated with the patients who've refused the vaccine and are now sick, her frustrations are with what she describes as a system of mis and disinformation online and elsewhere that's largely contributed to the current situation. And while there is hope in data as recent as this week that cases could be on the decline, a staff shortage could create issues that last much longer.
Staff is certainly the thing that concerns me more than physical space. I worry both, about just, working our staff so hard that they're stressed out and struggling to, get the energy to come to work every day.
Murray Boehner says for now, staff rely on support from one another. And while she's hopeful this won't last forever, she and others have a message for the community who've relied on their help from day one.
We need to put the safety of our community and the safety of our children and the safety of our elderly patients with cancer and other illnesses that prevents them from having a strong immune system. We need to put them above our own personal rights or personal political feelings about this pandemic and this vaccine and do the right thing.
Murray Boehner says she and other staff are also most concerned about contracting the virus themselves in a breakthrough case. And she says she's got a 1-year-old at home. It's too young to get immunized that she worries about each day. And we can hear more of our conversation, see everything she had to say on our website, channel3000.com.